Good afternoon. Thank you so much, Dr. Garg, for this opportunity. My distinguished dais and distinguished participants. I think Dr. India has set the discussion on this particular area of SLD, the Sustainable Development Goals 3 of the universal healthcare. I think we have been talking for a long time. And I like to just share with you some of our experience in the beginning on this particular technology. How technology today can be helpful to achieve these goals. Of course, no doubt that you need manpower, you need skilled manpower, you need infrastructure. But a few areas like the telemedicine and tele-education, which I would like to share, the telemedicine. The DJI took the lead in 2004. In 2004, first time in the country, the DJI thought that we should have outreach activities through telemedicine. With the help of ISRO, who gave us the satellite facilities, they funded us, and we have 5 centers in Punjab, community health centers were linked to DJI. And the regular consultations started from there. The doctors, they could raise questions, and while rotation, the doctor will come to the telemedicine center and answer those kind of queries. I'm talking of 2004. Subsequently, I'm sure that I think there had been more expansion presently. The Haryana government has established the facility to take the PGI's expertise. Then you have a tele-psychiatry facility, tele-pathology hub, tele-imaging hub. So I think that was one way of transmitting the expertise knowledge from an expertise hub to periphery. So this is one way that whereas the lack of experts outside the periphery, we could try to invite these outreach activities, try to fill up this gap. And tele-education, I'd like to share with you the COVID pandemic issue that we faced. And I think Dr. Uzaman, you mentioned about Punjab issue. I was actually chairing the Punjab COVID committee. Somehow the Punjab is always on the receiving end in whatever it does. I tell you, those 2 years, we realized the difficulty that we are facing. Punjab, with all its kind of infrastructure in the health, as well as the expertise or the manpower kind of thing, we were deeply worried, and I was asked to chair that committee. What we did, with the help of some of my colleagues from PGI, former colleagues from AIMS, we made it good. Every week, 2 sessions minimum we used to have. Some also took some experts from abroad who had gone from PGI, and then we were part of this COVID management in USA, UK, they were also part. Every week we used to have a Zoom session for 1 hour, twice a week, right from April 2020. The purpose was to educate our professionals on what is the latest for the COVID. There were a lot of on the media, on the WhatsApp, wrong kind of information. How to sort of give the right information to our professionals so they do the right thing. It was all interconnected, whether it was a private setup or a government setup. So every week, and we also, to attract our professional, made that people who were holding these sort of like Dr. Paul, DGI Siamar, Dr. Sonia Sopna from WHO, we invited each one of them, Dr. Talwar is taking on the vaccination program, to address to this group, so that to inculcate in them the ownership that we have to fight this. And 2 issues that I like to focus. One was the oxygen. When we had this huge kind of Delhi had gone through it. Those who belong to Delhi will realize what was happening in Delhi. There was special session for nurses, for the doctors, how to conserve oxygen. To make sure that we don't face the oxygen shortage. Because sometimes if you conserve oxygen, you save it also. Similarly was the mucormycosis issue. How to educate them, what to use. What I am trying to say that many patients from Delhi, I think I can give you examples, some important people shifted to Punjab for this kind of thing. So I think an unfortunate Punjab also gets a Dr. I'd like to share with you one because I thought why so that the state or somebody which are doing so good, but why they still always on the receiving end. When I was working in AIMS, so one of the always in the newspaper will something come about AIMS, criticism, this is not happening. I saw the same thing in PGI. So I asked one of the reporter, सब हमारे पास आते हैं, हम देखते हैं, फिर हमें आप क्रिटिसाइज क्यों करते रहते हैं? तो उसने कहा डॉक्टर साहब ये देखिए ये बाहर इतना ये फ्लाई ओवर बन रहा है, तो अब ये फ्लाई उधर सर्जन हॉस्पिटल में है, तो फ्लाई ओवर का नाम तो एम्स फ्लाई ओवर कहते हैं, सर्जन तो नहीं कहता। तो ये जो इंस्टीट्यूशन होते हैं जो इम्पोर्टेंट है उनको कुछ प्राइस भी देनी पड़ती है, इम्पोर्टेंट। तो आई थिंक people who deliver probably are always on this kind of anyway. So I think that tele-education is another way of how our professionals sitting in the periphery health center, community health center, how to educate them along with the latest and what can be done for a particular patient. And one example I would also like to share with you from the hepatitis C was the common, we see this issue. It can cause cancer, and we are not sure whether it's some genetic reasons. The then Chief Minister was also keen how to handle it. Again, a proposal was put that a free, with a PGI kind of background, because I had that time to respond from PGI. So what we did that every patient in the community health center, district hospital, and what we mentioned earlier of the referral, that particular project was patient picked up the periphery. What has to be done at the ground level through telemedicine kind of discussions? What in the district level, if something is more, what to go to PGI? The genetic studies were organized through a private person by payment. It was only costing 24,000 or so per patient. This particular project was praised by WHO. WHO then recommended to the government of India to adopt all India. This is published is one of the very high impact therapies. Even who was sort of conducting it. So I will say that telemedicine, tele-education, these are the issues that we sort of get it. The next is of course just now with technology. Now we have devices. We are being a cardiologist today. I think with a watch, you can smart watch everyone is wearing. And you can say, calculation where then you can try to pick out what it is there. So you have these kind of devices to warn you that something may be happening, what more precaution can be taken. The only issue with these is, of course, we as professionals also advise not to too much depend on that, because some people get sort of so much obsessed with that is difficult to bring them out of from that also. But they are useful. But question is cost of it. Here is the what technology we need to really work on, how we can have a cheap technology. And I think country has a huge, I tell you, this is one country where you had the infrastructure by the IITs, which said, I told that small example of we have a equipment in AIMS, I'm talking of 92. This was the equipment which was only available from USA. And that equipment, we got the difficulty to start a new procedure we call radio frequency ablation of arrhythmias. And suddenly in the lab, one night, the connector disappeared. It was a small box, it attached to the ablator, it disappeared. And the company told me that it will take 3 to 6 months to get it from USA. You have to flow whatever is the process is. We have few IoT graduates who are working with us on an esophageal pacemaker. We are working on that. I told them what to do now. We have just started this particular technique in the country and we are now lost 6 months we have to lose. Within 48 hours, you fabricated me with this small, not very nice looking, but small box attached to the ablator and we started. I think we have a lot of strength, but we have to cash on that. There is some kind of a involvement with the medical and the sort of technology so as to achieve these kind of things. Well, that shows that chaos, that health chaos is another kind of thing that you can try to read to the periphery for this diagnostics kind of a thing. Then we have now digitalization. Is digitizing the data. If you have a huge data, AI depends on the data. Dr. Ajit mentioned about artificial data. I really like to dwell more on that because that's, I think, the future of technology which may help contribute to sort of the health delivery, how we can sort of do our best in to reach to the periphery and as well as save the cost also. Now, as far as SDG 3 goes, it also covers the non-communicable diseases. The non-communicable diseases, I think now we say already that the country we are facing two sort of a burden of diseases. We have non-communicable diseases, we have still communicable diseases. We have dengue, we have malaria, we have huge tuberculosis. At the same time, we are now capital of world capital of diabetes, we have hypertension, we have coronary disease. So we have the double burden. The non-communicable diseases like heart attacks or say hypertension, diabetes, they can be sort of prevented. So we must also adopt a very kind of active preventive strategies, and there are many stakeholders for that. Like you have health ministry, of course, is there. You have Department of Education. Unless we educate our youngsters on this, in the school, colleges, there should be some kind of a education on this, that how can you prevent these kind of diseases. And then you have after urban development, you must provide people where they can walk, they can do exercise. You must have sanitation issues that you have that sort of you don't get pure drinking water, you don't have adulterated food. So these are the preventive things, and using also the digital media to educate people that how to prevent, what the steps you should take, you should regular exercise kind of thing. So I think preventive is, I think, main, and there's no cost involved. The patient doesn't pay anything. It's only you educate them. And of course, smoking issue, alcohol issue, I'm surprised most of the government, I think alcohol has become their earning kind of a thing. But I mean, I am not in favor of prohibition. But why don't you restrict it? Today, I think the vulnerable age group for any kind of issue is 16 to 23. Once we try that the colleges, the schools, they should try in this age group protect them by educating them. Also making like, why don't you raise the alcohol intake age to 23 or 21? Why 18? Could not see. I think now the technology, the deep learnings, the computers can be taught by feeding data to identify, interpret, and I think AI is going to be probably the main area for imaging diagnostics. It is going to have a game change. You have ECG, you have X-ray, you have a CT scan, MRI, coronary angio, you feed into them, you get the right report. And probably that is going to be sitting in the periphery. You don't have to have an expert to read MRI, then you can get. So I think this is one area where is going to be a huge benefit. Apart from that, I think there is another thing that we, like in surgery, you plan various things. You need an investigative report, you need imaging report, you need your planning. Probably AI can help you by collating everything. So this is another way that AI. So I think we need to. Probably I personally feel that we need to push this particular field much more than what probably we are doing. And the digital health mission, whatever that we are digitizing our data, we should not let our data go out. We must make, because that is also an issue when the interpretation of AI is based on the data. And if you feed the data of a different race, that may not apply to the other race. So I think we must try to see that our data, wherever is available, we try to sort of work on that and have that kind of models available. There's a field coming for no precise medicine, personalized medicine. That I think it individual, and I think I appreciate our Avivara second on this. Those issues which were that you can say this medicine will fit this one, this will not fit this one, because based on your phenotypes. They had a system, they could say, आप इसकी dose विषय है या वे इसकी है तो probably medicine. I think in allopathy also this is going to be the precision medicine, and here AI is going to be huge importance. Based upon your phenotype, various factors, your pulse rate, blood pressure, other investigation, it may be that probably this kind of approach will suit you better than the other. So I think the time has come. We need to look into the so that we invest more into, I think, by combining with medical institutions and the technical institution. I think that is the area we should, I feel, go for. But before I think we want to take a lead in the sort of globally. I always felt that medical research, we have done very well in medicals, as I won't say research, but in medicine as such. Today, any kind of procedure at a very small cost, much lower than what you see in Europe or America, can be done. Any procedure. You have expertise available in the country. People are coming from abroad to us for the treatment just because they know that you can get a quality treatment at a very low cost. But what we have lacked is in medical innovation and medical research. And that's why most of the devices, still like a pacemaker, they still depend upon that we not have our own kind of a pacemaker. Luckily now some people are like stents are start coming, otherwise they still dependent on the sort of the importing them. So that is the innovations we need to really go into that. Of course, I think there's another, they say AI can also help in public health. They can excel in surveillance and outbreak prediction by analyzing social media, travel pattern, and healthcare data. AI system can detect early signs of emerging outbreak and predict their potential spread. This real-time intelligence empowers public health officials to deploy resources strategically and contain outbreaks. Similarly, in emergency, now you have an ambulance fitted with AI. You have the data right from the peripheral village transmitted to a expert center, and they sitting guiding the paramedical do this and also prepare that the patient who is coming has this kind of issue and we have to eventually go. So I think these are the way how technology, emergency care, public health care, I think all field of medicine, this particular science is going to contribute to sort of address to these issues. I think now the AI wisdom is coming. I don't know whether that's another which has been mentioned, that it may apply knowledge, experience to make sound judgment, maybe as good as human mind, but I don't think so. I think they can't replace human beings. The medicine is not only they say the medicine is a science, but the practice is an art. And art, I think only human beings have. No machine can be taught an art. I think these were some of the issues that I thought I'd like to share with you, but of course, luckily we have a Provija from IIT. I say that there are certain gaps which are mentioned in this, like skill gap, regulatory and ethical concerns, cultural and behavioral factor. People are not really prepared that, okay, we sort of healthcare policies, internet connectivity also, you have to have sound of, you have to have perfect this to get the sort of benefit of telemedicine, tele-education, or even AI. So I think we need a partnership, and that is also one of the SDG 17 that we need a partnership. You need medical community, you need industry, you need engineers, NGOs. So all I think have to join if we have to try to make sure that everybody gets the affordable health care today. I think that is the most painful thing for us professionally when we see a patient. We see you can't give him this treatment because of the cost. This is the something I mean, it shakes you what to do for him. I mean, you can only approach some people to fund for it, but how many? So I think that is the partnership is important, and I think government needs to sort of even encourage the charitable sector in health particularly, because I remember a statement somebody said government should invest in public health, should support charitable, facilitate corporate. Corporate has in health has come, but somehow the other only thing is they must realize that health is a area where they should not look it like industry. It is an area of service to the community, and there should be coming. So I think we need to sort of and the I think flagship program of the government of India, Ayushman Bharat, which is something which has a large number of patients which could not otherwise think of getting the treatment are getting. But I only feel that a large section of society, middle society, middle economic status society is still at a loss because private sector is very expensive, public sector have some other difficulties, and I think here is an area where I wish the government comes with some kind of a subsidized insurance where each one is advised to put in some money and some sources to make sure that everyone who needs get a affordable quality healthcare. Thank you so much, Dr.